Hello everyone, my name is Hiranyada and today I'll be covering the topic of atrophy from the list of your final questions from general pathology. Okay, so whenever you go in for the exam and you get this question, what do? You first start off with what is atrophy. So you define it. And the definition for atrophy is the reduction in the size of an organ or tissue due to decrease in the cell size and the cell number. So it can be either a decrease in the size or decrease in cell number or both. And this is only valid if the organism has attained full development. Two more points to remember here is that first of all, atrophic cells have diminished function and a reduced metabolic rate. They are not dead. So remember that. Secondly, this process is usually reversible. So if you look at the picture here, you can see that atrophy can be numerical. I'm repeating it again. Numerical when there is a decrease in number, or cellular atrophy, which is also called hypertrophy, which is a decrease in the size of the cell. Within the cell itself, the organelles, their size also decreases, and this leads to a decrease in their metabolic needs. Moving on to the causes of atrophy, the slide that you see here is a screenshot from Professor Dushkova's presentation. I will be covering all the points in detail and you can find their detailed explanations in the slides ahead. So first one is vascular atrophy. Vascular atrophy is when there is a reduced blood supply to a particular organ, and this can be due to atherosclerosis. When this happens, there is ischemia of the organ, which further leads to organ atrophy. In case of inactivity, this is also called the atrophy of disuse, which leads to hyperfunction of that particular organ and is caused by a decreased workload. So for example, when you have a fractured bone and it is immobilized in a plaster cast, or when the patient is restricted to a bed rest, that is when a skeletal muscle atrophy occurs because it is not being used. So initially, there is a decrease in the cell size and is reversible when you resume activity. But when this disuse and when this inactivity is prolonged, the skeletal muscle fibers also decrease in number due to apoptosis. So this is the point when your reversible atrophy suddenly becomes an irreversible one. And this also leads to muscle wasting. This further can be accompanied by increased bone resorption, which leads to osteoporosis of disuse. So decrease in the muscle fibers, further causing damage to the bone, and then there's osteoporosis of disuse. The next one is inanition. Inanition is a very complicated word, which in simple words means that there is atrophy due to inadequate nutrition. So this happens when your reserve energy sources, for example, your adipose tissues, are completely utilized, and then your skeletal muscle starts breaking down proteins as a source of energy. When this happens, it also leads to muscle wasting, which is seen as cachexia in a person. The next one is neurogenic. Neurogenic is due to denervation of the muscle, or can be due to a lesion in the spinal cord or degeneration of the spinal cord. So basically, there is damage to the nerves, which leads to atrophy of the skeletal muscle fibers, which are supplied by those nerves. And as a result of this, there is atrophy, and their metabolism, which depends on this innervation, also decreases. Ionizing radiation also causes atrophy, and the effects of this particular cause is further manifested as an oncological manifestation. So examples of this can be UV radiation or some amount of nuclear radiation that is emitted and absorbed by the body. The next one is involution. Now, what is involution? Involution is shrinkage of an organ in old age or when it is inactive. This is usually physiological, And the very important example for this is our thymus, which slowly and steadily involutes as we age. Another example that you can include in this is the uterus, which reduces its size after childbirth. In case of senile atrophy, we also call this somewhat a physiological process because it happens as a person ages. So what happens is that in late adult life, the brain undergoes progressive atrophy, mainly because of a reduced blood supply due to atherosclerosis or due to a decreased metabolic rate. For endocrine atrophy, it is very simple because it just means that whenever there is a loss of endocrine stimulation, there the organs that for endocrine atrophy, it is very simple because it just means that whenever there is a loss of endocrine stimulation, there the organs that are dependent on these hormones undergo atrophy. So, for example, if there is a loss of estrogen stimulation after menopause, it physiologically results in the atrophy of the endometrium, the vaginal epithelium, and the breast tissue. And of course, anything in medicine can have an idiopathic and unknown cause, and that's what causes the atrophy. This slide basically covers a detailed explanation of what I just said in the previous slide. So I won't spend a lot of time on it. You guys can read through it. And yeah, that's all. So there were a few points that I did not mention in my previous slides that I'll be mentioning here. First is the post-inflammatory atrophy. Now, as the name suggests, this happens after an inflammatory process has occurred in a particular organ. The most prominent example for this one is the prostate. So, the normal prostate has columnar cells, which are secretory columnar cells, and basal cells. Now, these cells form from certain cuboidal cells and basal cells, and when these cuboidal cells, as you can see here, cannot convert or fail to form the columnar secretory cells, that is when you see that the prostate is undergoing atrophy. Now, what happens is that such a process is a precursor to the prostatic intraepithelial neoplasia, which further leads to prostate cancer. So, such process is seen in a chronic inflammation. Another one is atrophy that occurs during development. This is also an example of a physiological atrophy and happens with some of the embryonic structures. For example, the notochord. Notochord undergoes atrophy during fetal development. So that's about it. And the last and the most important one is atrophy due to pressure. This can be seen in patients who get pressure ulcers, and it can also be seen in lipomatosis kidney, which is a very important point from one of your lectures. And what happens is that in obese people, where they have an excessive amount of adipose tissue, this tissue compresses the kidney and causes the change of the kidney parenchyma to fat. This is this is an overlapping example with atrophy and metaplasia. So moving on, we will now talk about the mechanisms of atrophy. So atrophy can be due to three things. So it's basically a game of demand and supply. So it can either be due to an increased degradation or breakdown, or can be due to decrease in synthesis, or can be due to autophagy. Now what happens is, whenever there is increased degradation, the ubiquitin tags certain molecules or certain cellular proteins. These cellular proteins, which are tagged by ubiquitin, are degraded by proteasomes. Such a thing is seen in patients who are cachexia and have cancer. With decreased synthesis, it is due to reduced metabolic activity, can be due to lack of nutrition, as we discussed before, can be due to a reduced blood supply or decreased endocrine stimulation. These factors together or separately contribute to atrophy. With autophagy, it is the process wherein the cell, first of all, the cell is starved. So what it does is, because it has no food for itself from the outside, it starts eating and utilizing its own components to meet the nutrition demands of the cell. So that is what is happening in autophagy. And an example for this is formation of the lipofuscin granules in the myocardial muscle cell. So before I end, there are certain important examples that are mentioned in the lectures and the professors like to ask about it. One of which is your atrophic kidney, so decrease in the size of the kidney due to sclerotic renal artery. So it's an example of your vascular atrophy wherein the blood supply to the kidney is affected, and that leads to atrophy of the kidney. The second one is gastric atrophy, which is an example of inflammatory atrophy, which is seen in case of Whipple's disease or any kind of malabsorption syndrome where there is impaired absorption of fats or carbohydrates or even proteins. The third example is atrophy of the adrenal cortex, which is an example of your endocrine stimulation. This happens in the absence of corticotrophic stimulation, and what happens is that the adrenal gland becomes atrophic because it is not receiving any stimulation or any feedback. This leads to an Addisonian crisis and symptoms related with the Addisonian crisis. And the fourth example is muscle atrophy, which can be related with either uh, inactivity, or it can be related with some kind of innervation issue, or it can be related with a spinal cord lesion. So these 4 points you should keep in mind because they're mentioned in your lectures. So thank you so much guys for attending, and hopefully I'll see you in the next lecture.